In this AllForBabies video, we explain what the symptoms of autism are in children aged 2 and 3 years. Lack of symbolic play. This, along with the emergence of language, is the most relevant developmental indicator at this stage. Symbolic play appears in a very primitive form before the age of 2, extending and improving well into early childhood. Through the practice of this play, the child can express, with or without materials, their interpretation of the world, using symbols to express their perception. At first, they may not use any verbal expression, but they will progressively accompany play and actions with words. When a child does not initiate symbolic play after the age of 2, it is necessary to observe their behavior during play and the context in which it occurs, as it may be a sign of ASD. Delay in language development, both in expression and comprehension, not being able to follow simple commands or understand basic rules of social interaction, closely related to the acquisition of autonomy habits. This is one of the main warning signs that may suggest autism spectrum disorder, although there may be other causes. Lack of interest, especially in peer groups or siblings. They show no curiosity about how others play, interact with others and with their surroundings, and show no intention of interacting with them. They also do not point with their finger or look where others are pointing, and do not respond to their name. Does not imitate others. Learning that occurs through imitation and observation of how others act in certain situations is practically non-existent. Struggles to pronounce basic words, especially words that connect them socially and ensure their safety and survival, such as mom, dad, water. If they manage, the difficulty will be in constructing two-word phrases with the vocabulary they have. Lack of affection. Their emotional language is very poor, and they struggle to interpret signs of affection, and it is uncommon for them to show affection. However, they may have unusual attachment to certain objects. Repetitions. They may exhibit repetitive body movements known as stereotypies, as well as a lack of control or temperamental dysregulation. What to do when the first signs of autism appear? Autism presents very specific and concrete developmental characteristics. Despite having access to a wealth of information, and anyone can educate themselves and detect any developmental deficiencies in a child, only authorized and responsible individuals to make a diagnosis are doctors and specialists. For this reason, when in doubt, fear, or insecurity, it is important to consult a professional who can rigorously and fundamentally evaluate and then propose a treatment plan. We hope this information has been helpful to you. See you in the next AllForBabies video.